You deserved everything you got. This is a union city.
That is a Philadelphia tradition.
Seize the means of podcasting.
Oh God, the boss has crushed us.
Let me tell you one thing else.
In oldie-timey times,
Who said it? Kanye West or Thomas
we
Paine?
will not raw dog reality for that one.
The pleasure of the flesh is in solidarity.
The Scab Buster.
It's gonna be wholly unprofessional.
Eight together strong. Let that be your mantra.
My name is Sam James. I'm occasionally the co-host of this program, and I am joined today and always, forever, by who? With?
I'm Gabe Christie, and I'm never the co-host of this program.
Really?
Nope.
Who I've been talking to the last 15 episodes?
I don't know. It's my first time.
It was a man of your build who was deliciously sexy.
It could have been my doppelganger, Abe Christie. So it's probably
Abe
it.
Christe.
Yes. We're gonna go a little bit more modern than we have been of late.
I'm excited.
So, it's the strike at the St. Mary Medical Center
Oh,
in
okay.
2020. So I guess if someone is listening in the far, far distant future, we should explain what was going on in November of 2020 that might have had an issue.
Our children might be listening to this.
It's true. When this gets archived by the Library of Congress
Oh, yes.
and preserved.
Yeah, they've been talking to me about that.
Yeah. So in late 2019, there was this new virus that started showing up around the world.
Chlamydia.
Yep. And they gave it the really inventive name of the Coronavirus Disease 2019, or COVID-19.
Ooh.
So it is, because we're still in the midst of it, which is fun, a highly infectious respiratory ailment, which can be spread by aerosolized particles in human breath. It attacks the lungs, leading to, the first variants primarily attack the lungs. By the time you listen to this, there's probably going to be a variant that turns you into a snake or something. So as COVID cases rose, so did hospitalization rates. Weirdly enough, there was some correlation there. And especially early on, before any vaccines were available, basically the only effective treatment that they had, or the only available treatment, was
Bleach and sunlight.
Yeah, if you can inject sunlight, drink lots of Sunny D, because UV light kills it. So the only effective treatment was basically.
Oh, this is gonna bring back so many bad memories.
Yeah.
Why did you do this? We could have just talked about a bunch of people in the 18th century getting killed by policemen on strike, but you had to bring this up. We had to do this one. It could have been such a joyful episode, Gabe.
This was supposed to be a short one, but it's not going to be.
2020 was the longest year.
It was. It's still
and the
going
shortest
on.
year, actually. It was weird.
Yeah.
It was like some weird, black hole, you know? It was like you're on the edge of the black hole, but you're also inside of it at the same time.
Yeah. Well, we had a collective year-long panic attack. So it felt really long in the time, but looking back at it, it felt like a moment. And so I'm sure that's great for our mental health.
I had the time of my life. I don't know what to tell you.
Yeah. Basically, the only effective treatment was basically you just had to put the patient on as much life support as you could and then let the body defend itself. Which is not necessarily an elegant solution, but it was all that was available.
It was all we had.
Yeah. But it meant that there were a lot of patients in a lot of beds needing a lot of care. And then in steps America's private healthcare system. Yay!
Ladies and gentlemen, would you all please stand for our overlords?
So a lot of hospitals in the U.S. focus more on streamlining and efficiency than patient care.
Yeah.
which makes them not great places to work. And so for the nurses at St. Mary's Medical Center, that meant that they were doing more and more work with already limited staff. And they basically just had to, or they kept getting tasked with more and more without any extra support. But they kept calling them heroes.
Essential workers, definitely. Yes. They are our heroes, Gabe.
Mm-hmm.
And we said it on the news. We put up little signs. We had little clappy clap parades when they go into work.
Yeah. So, and that's what they've been asking for.
That's all they wanted. Is like, can you please call me a hero? We can just be heroes.
Yes.
Just for 1 year.
It's how you pay your bills.
Yep. Mm-hmm.
So,
well, yeah. Oh yeah, exactly. That's
Mhm.
it. I do that sometimes. When I write a check, because I was an essential worker. You know, I was a grocery worker during 2020, and when I would have to go to a grocery store, like the one I work at, to actually buy food, I would use a check, and I would just write where it says the money part. I would just write hero, and they would accept it.
That's how it works.
And then I woke up because I passed out because I couldn't get my insulin because it's $500 a vial. So
yeah, this is I can see no problems with this system at all.
Gabe, just get into it.
Okay,
Gabe, I'm strapping myself to this chair. Okay.
So Bill Engel, who was a surgical nurse with 17 years experience at St. Mary's, was quoted saying that up on the floors, we were looking for certain ratios. On the medical surgery telemetry unit, it should be 4-1, maybe 5-1, or 5-1. There are days we have 6 patients each, 7 patients each.
Wait, that's 5 nurses or hospital staff to a patient, you're saying?
5 patients to a nurse.
Oh, okay. Ooh.
Ideally, you want 4 patients to a nurse.
Oh, okay.
They're working with 7 patients to a nurse.
Jesus Christ.
Like more than double.
Goddamn.
Or almost double, because I can do math. The year before, in 2019, they had formed a union, or the nurses at St. Mary's had formed a union, with the Pennsylvania Association of Staff Nurses and Allied Professionals, or PASNAP.
PASNAP.
So, when coronavirus hit, they were still in first contract negotiations.
Oh.
So they had a union, but
they didn't have a contract.
Yeah, they didn't have a contract, which meant they still didn't have good union wages.
Yeah.
So when COVID hit, the nurses were also making $6 to $7 an hour less than nurses at other hospitals only 20 minutes away.
Really?
Yeah. So they were dealing with insane numbers and low wages. And so before the strike happened, there was just a mass exodus from this hospital of nurses quitting because they didn't want to deal with it for terrible wages. But you can't blame them. So the nurses ended up going on strike at 7 a.m. on Tuesday, November 17th. It's also important to note that even though the hospital and some other folks in the area tried to slander the nurses, saying that, like, well, you shouldn't be going on strike now because the patients need you. Mm-hmm. They were very explicit that they were going on strike because the hospital wasn't giving them the resources they needed to actually provide good care to their patients. Yeah. Because that's the other side of it, that, like, it's not just these nurses are getting burnt out. It's they're getting burnt out because they're trying to provide top quality care, and you are physically unable to do so. Yeah.
And all hospital management cares about is keep it in the black, right?
Yeah.
Keep it in black. Keep it in the black.
Yep. And
yeah, it's all about money.
Everybody's just a pile of numbers on a spreadsheet.
Yeah. So, I mean, it's okay for these hospitals and insurance companies it's okay for them to care about money. But when the nurses care about money or the staff,
then they're greedy.
Then it's a greedy that they don't care about their patients.
Yeah. About 800 nurses walked off. It was over 700 from St. Mary's itself. And then they had supporters from other PASNAP. And it was about 85% of the union membership voted yes to strike. So pretty good supermajority. Another interesting thing that happened was they actually had former patients come out and join the picket line with them.
Oh, really?
There was one guy that they interviewed who sounded like he had been released about a month or so before, and he was pretty explicit, being like, the people on this picket line saved my life.
Yeah.
I owe it to them to be out here. Yeah, if the patients are saying that, yes, you should be striking, then you should probably be out on strike. So that strike was also only supposed to last 2 days. Because I should also point out, the way nurses' strikes and strikes at hospitals generally work is you have to provide the hospital with notice that you're going on strike. So that...
Okay.
Because you can't interrupt patient care.
Fuck.
Yeah.
Man, we're giving you 2 days warning to hire scabs.
Basically. But and St. Mary's is a nonprofit, is the other side of it.
Okay.
So, like, they're not... I mean, they're making money off of it hand over fist, but that's not technically their goal.
Yeah.
So so you have to provide notice that you're going on strike so that they can hire scabs to cover for you while you're out on strike. But the way that ends up hurting the hospital is, and I think they're usually called agency nurses, the scabs, and they cost
Pinkerton agency.
Yeah. They cost way more than your normal staff nurses.
Yeah.
So, because you have to pay for travel, pay for room and board, and then there's usually, the wages are usually like 2 or 3 times what the staff nurses make. But the hospital hired scabs for 5 days. So the union only wanted to strike for 2, which just meant that the strike lasted for 5 days.
Oh, okay.
And so they kept a picket line going for 5 days straight. Finally, on that Sunday at 7 p.m., I believe, a shift went back in and returned to work. Hospital didn't cave immediately. The negotiations continued for the first contract. And finally, on December 20th, I wrote down 2022, but actually December 20th, 2020.
I'm like, damn.
So a month later, which in contract negotiation time, like, that's not insane. So they got their contract on December 20th, 2020, with better wages, set raises, which is important. So they have annual raises after the contract goes in. But those staffing issues still persisted. So they won some and they lost some.
Yeah.
And also, I mean, not being as terrified about putting food on your plate every night makes you a better nurse.
And
because you can focus more on your job.
You know, this job would be really great if there weren't any patients.
Yeah. So wear a mask, get vaccinated, support your nurses.
Fake news. Fake news.